This is the case study Boston Children's Hospital Measuring Patient Costs. Boston Children's Hospital is a leader in pediatric care. In 2011, they saw over 500,000 patients there. They have over 228 specialized clinical programs, surgeons who perform more than 26,000 procedures a year, the world's largest pediatric hospital bed research center, with over 1,100 scientists working, and Nobel Prize winning work has been performed there. So the challenges that Boston Children's Hospital faces are that because they handle some of the most complex cases, they have very high costs and very high prices of the care they provide. And Boston Children's Hospital is a freestanding pediatric hospital. It can't absorb costs through cross-subsidization in the ways that larger healthcare systems can. Tufts Medical Center is one such example. This healthcare organization is large and has other types of care it provides that are better reimbursed, that can cross-subsidize the more expensive pediatric care. Payers see the higher pricing for services and begin to limit offerings and increase cost sharing to consumers. So Boston Children's Hospital starts to get kind of pushed out of the marketplace for some payers, and some payers actually have consumers in plans where there is an increased sharing if they choose Boston Children's Hospital. Underlying problem, the use of crude internal costing systems has led to inaccurate assessment in the cost of care needed for specific medical conditions. The cost of care across the patient care cycle for specific conditions really isn't well understood. And there's very little understanding of how efficiently resources could be applied for care processes and how much value there are to those resources. This graph came from the Office of the Attorney General of Massachusetts in a study in 2010 looking at the variability among payments made to different providers across Massachusetts by the Tufts Health Plan. And as we can see, there is quite a variation in the payment to different groups of providers, almost a 2.5-fold if you look across the spectrum. And that can't really all be due to quality. It looks like, in fact, that third-party payers have systems by which they dictate what they pay based on past performance and past payment, as well as risk-adjusted values. That's somewhat different from the way healthcare systems look at their costs. And so it becomes very important for us to actually look at our costs so that we can understand from a better frame of reference how to negotiate with third-party payers in payment for the services we provide. So accurate costing of healthcare across the patient care cycle allows for a better understanding of those costs from the perspective of the coded medical conditions that we bill for. Better pricing strategies could be developed and more accurate cost estimates given to consumers who are being asked to share a higher amount of the cost as they have higher deductibles and more out-of-pocket costs. This knowledge could be leveraged when negotiating payment for services with third-party payers. As they move towards value-based strategies like global bundled payments for specific medical conditions, we'll understand what our costs are from the same perspective. Internal costs, activity-based costing traditionally in healthcare systems has used more traditional methods like the ratio of cost to charges. We've looked at all of the expenses for revenue centers and all the charges that they put out, and looked at the ratio of those and used that ratio to cost specific activities and procedures. This is a method that uses averages across the course of a year, and because of that, it's not very accurate when you try to drill down to a specific medical condition. Relative value units are another internal costing method for activity-based costing, where we look at resources applied to care activities and use a standard calculation of a relative value unit to indicate how much of that resource for each care activity. This also uses data that's gathered over the course of a year and averaged together. And using this kind of aggregate data makes it very difficult to drill down to the actual cost for specific sets of care activities around specific medical conditions. And so the need for that kind of information has led to time-driven activity-based costing. Time-driven activity-based costing allows us to map the processes around specific care activities used around specific medical conditions, and allows us to look at the resources that we would apply, how much time those resources are used in the care activity, and then how much cost is associated with those resources. So the Department of Plastic and Oral Surgery at Boston Children's Hospital took a look at the traditional ratio of cost to charges costing and time-driven activity-based costing for 3 specific medical conditions: craniosynostosis, neoplasm skin excision, and plagiocephaly. And in this case, all 3 were calculated to have the same cost for initial visit by ratio of cost to charges. But when a more specific time-driven activity-based costing analysis was applied, we saw that craniosynostosis actually incurred a higher cost, and plagiocephaly actually had less cost on the initial visit than what the ratio of cost to charges predicted. The Department of Orthopedic Surgery had traditionally costed their services around casting, application and removal of casts, using a relative value unit-based system. They cross-compared that with time-driven activity-based costing and saw fairly good comparison for 3 out of 4 of the types of casts. But for the most simple cast, the cotton-padded long leg cast, the actual resources needed to perform that activity demonstrated that the costs were quite a bit lower when we used time-driven activity-based cost analysis than the traditional relative value unit-based method. So the advantages of accurate costing: the ability to price competitively and transparently is an important advantage. Understanding the cost of specific medical conditions allows us to leverage negotiations with third-party payers as they move towards newer pay practices. Having a process map with specific costs accurately laid out aids us in our improvement efforts to identify value and eliminate waste. Understanding resource capacity helps in strategic planning efforts. So alternative approaches to time-driven activity-based costing, there would be some benefit possibly to maintaining these traditional internal costing methods because they're easier to apply, they require less resources, and they give a pretty good global perspective of what's going on over the course of a year. Ratio cost to charges and relative value unit analysis might provide enough information if we're looking over a broad number of services or a long range of time. Time-driven activity-based costing might be more strategically applied in specific situations where high costs are identified. Of course, there are risks associated with staying with these traditional methods. Failure to understand costs accurately could lead to poor planning. The impact of global bundled payments for specific medical conditions might not be well understood and leave us in a poor way when trying to develop strategically around newer payment practices. And consumers could be left in the dark about what their healthcare costs should be, and we should know what those cost so that we can accurately price those and compare that pricing with our competitors. Organizational implementation of time-driven activity-based costing could occur with direct oversight by a committee which was manned by people from administration, people from finance, clinical leadership, and experts in activity-based costing, time-driven activity-based costing. This committee could identify some of those places where there are specific medical conditions where TDABC could help to identify new strategies. And in these departments, we could reach out to those leaders and they could develop TDABC implementation teams, which would then map specific healthcare processes around care activities used in specific medical conditions. They could identify the resources used, estimate how much time those resources were involved in care, identify the cost of those resources, and estimate the capacity cost rate for those resources, and then more accurately calculate total costs for care activity across the care spectrum for specific medical conditions. This is a change in the way that activity-based costing has been done traditionally at Boston Children's Hospital. So it would need to be sold to top leadership. They would need to understand the value of it. Clinical leaders would also need to understand the value of time-driven activity-based costing and identifying care processes, the cost around them, and the potential to do things in a more efficient way for patients and still provide high-quality care. Time-driven activity-based costing could be married to outcomes, and then we could have a quantitative assessment of the value of the care that we provide to patients. This is an important alignment with strategic vision of excellence of Boston Children's Hospital. Accurate cost analysis and finding value is critical to the underlying goals of TDABC. We want to develop implementation teams to undertake TDABC efforts guided by experts in the field. We want to share cost data with department leaders and ensure that that data is validated by people on the front lines. Data about resource utilization and resource capacity, it's very important that that data is accurate so that we can get good cost information. We want to utilize that cost information to better understand price strategies, relationships to outcomes, and quality improvement efforts. We want to use time-driven activity-based costing where opportunities are identified so that we can improve value and reduce cost in the most effective manner early. We want to celebrate and share early success to establish a model to continue TDABC throughout the organization. We want to communicate this success throughout the organization and build a culture around accurate costing and around better patient satisfaction and transparency for consumers. We want to move from these early observations in the Department of Plastic and Oral Surgery and the Department of Orthopedic Surgery and spread that to other departments through the hospital. We're going to do that by clearly quantifying the gains that TDABC has shown us. We want to share these values and emphasize why they are strategically important. We want to demonstrate how opportunities are exposed by this thorough mapping of costs and what kinds of financial effects can come from strategies to rethink these resources. Departments with similar concerns will be the ones that are most interested in engaging efforts undertaking TDABC. Implementation should be strategized in the following way. We need to ensure that team leaders have good team building and leading skills. We want to ensure that there is a culture of accountability around this effort. We want to have strong timelines and milestones around what we're doing. We want to reward early successes and create this model for costing services. We want to emphasize alignment with strategic vision of Boston Children's Hospital. We want to also measure positive gains from time-driven activity-based costing and share that data across the organization. The healthcare marketplace is moving from a volume-based market to a value-based market because costs have become astronomical in healthcare, and we need to reduce costs and ensure that we are maintaining quality. We have local competition from integrated health systems that can absorb pediatric care costs and leaves a healthcare organization like Boston Children's Hospital, which is a freestanding pediatric place, in the need to have a more accurate assessment of its costs. And because of this market shift from volume to value, we have to identify efficiency in those costs. And we have to identify how that relates to outcomes. We need to make changes to reduce costs and ensure that outcomes remain good. There's pressure from consumers for transparency and accuracy, and there's pressure from third-party payers to make sure that there's good, strong understanding of what we're doing to increase efficiency and to help consumers understand the cost of healthcare. Boston Children's Hospital is a top leader in pediatric care and research and continues to be so through 2015. Uh, Skyrocketing healthcare costs are a very serious problem, and significant legislation in the Patient Protection and Affordable Care Act has been passed to deal with these cost containment issues and quality issues. So, an accurate understanding of costs and how they relate to outcomes is going to be key in our efforts to move towards value-based healthcare.